I want to add before I forget to something, Stephanie, just the last point she was making on that last slide, is one of the things that I value about and just really credit midwives and doulas and some of the things that we have access to here is that the interventions she mentioned, or knowing somebody, having somebody there that's going to support you and knows those things, are so important, because I see it from the having to take care of the baby after a traumatic birth, you know, when I'm adjusting or treating and the baby is a patient. And unfortunately, many obstetricians, that when she talked about that there's some minor problem, the baby's posterior, they don't give it time to turn, would then be diagnosed as failure to progress, right. And then it would be the reason for a C-section or some other intervention that unfortunately might escalate into a C-section. So, so it sounds like I'm preaching to the choir, because all of you are planning on using a doula or midwife. All right, so I'm going to talk about chiropractic and specifically about something called the Webster Technique. But somebody asked a really good question before about what's the difference between the Webster Technique and what a general chiropractor would do, and I'm going to discuss that also. Okay. So first I want to talk just a little bit about what chiropractic is in general, but I want to kind of know my audience. So how many of you are currently seeing a chiropractor right now? I know Abigail is. Okay. A few of you. Okay. How many of you have seen a chiropractor before? Okay, right, so a couple of you haven't, which is fine, so that's what I want to explain. So I was going to skip over this if you all had a good experience, or had an experience with chiropractic. So the basic thing is really this top part of this paragraph here, and that is that chiropractic is much in line with the philosophy or the paradigm that midwives and doulas have, in that we have the paradigm that the human body is a vitalistic body, that the body is created and designed to work intelligently. Okay, so it's a whole different way of looking at health compared to allopathic medicine or conventional medicine. Chiropractors, unlike physical therapists or other kinds of limited practice physicians or healthcare providers, we're fully licensed to treat all patients. Patients come in directly to our office. They don't have to be referred here by another doctor. But our way of looking at health is completely different. So it's based on the fact that the body has an innate ability to heal, a normal way it's supposed to function. You might be familiar with the term homeostasis. A lot of people talk about homeodynamics. And homeostasis is a similar concept that your body always is trying to vary so that your body, for example, there's a homeostatic effect on your heart rate. There's part of your nervous system, your sympathetic nervous system, that speeds your heart rate up, and then there's your parasympathetic nervous system that slows your heart rate down. And it's that balancing act, that homeostasis, that allows you to function correctly. Homeodynamics really is a step further, that really static, being static in the human body is not healthy. Your body should always be adapting and changing. So in other words, we know, chiropractic knows that there's an innate ability of the body to adapt to its environment, and we know that you live every aspect of your human experience through your nervous system. We have trillions of cells in our body, but those cells all have to work together, and it's through the nervous system that those cells do not only work together, but that we adapt to our environment. So, you know, hearing me speak, for example, is coming in through your nervous system, through your senses. You're also using your nervous system to compare everything I'm telling you to all of your previous knowledge that you already have. Okay, so literally the nervous system not only controls every cell, tissue, and organ in your body, but it controls how your body adapts and how you experience life. Okay. What chiropractors do in application is we try to optimize the function of the nervous system by removing what chiropractors call subluxations or misalignments in the spine that can damage, irritate, or affect that optimal nervous system function. Okay. We also have a different paradigm in conventional medicine in that we have a focus on how patients move, how they eat, and how they think. Okay, so, and that's, especially in our clinic, like I said, is a natural health kind of a clinic. Basically, as Stephanie talked about, I can't overemphasize how important nutrition is, so to speak. I can't overemphasize how important it is to exercise and move, and positive mental attitude or stress reduction is super important. But, on the other hand, you can do all of these things right, but if your nervous system isn't functioning optimally, your body can't possibly get the most out of those beneficial things you're doing. Okay, so a big misconception a lot of people have is that chiropractic is not a treatment for back pain or a modality applied to the treatment of disease which is a more conventional kind of a approach that an allopathic doctor would do. I tell people a good way to explain it is that many people get back pain relief, or relief of headaches, or relief of abnormal positioning of the baby in utero, but all of those things are beneficial side effects to improving the function of your nervous system and the normal function of your body. So chiropractic is focused on enhancing the ability of your body to work the way it was designed to, as opposed to overpowering it, which is more the allopathic approach, which sounds like just a subtle difference, but it's a huge difference. Okay. Oh, I skipped over the fact that I firmly believe one of the reasons that I'm taking the time to do this workshop tonight is that I firmly believe that there's no other time really when it's more important to see a chiropractor than during pregnancy, and also for the newborn. I think that the changes and the benefits you can get from chiropractic care during those periods are the most important, and I'm going to talk a little bit about why that is. Okay. So the Webster Technique specifically is a technique that I'm certified in that not all chiropractors do, but it's a specific chiropractic analysis and then adjustment that looks at reducing interference to the nervous system and then balancing the muscles and ligaments. One of the last slides that Stephanie showed, showing the ligaments, which in turn can reduce torsion or stress on the uterus, causing a uterine constraint. And then the reason we want to do those things is to allow the baby to move into that normal optimal fetal positioning that she was talking about in preparation for a good birth. Even if the baby is in a normal position, this Webster technique allows the pelvis and the uterus to function optimally so that women have a better labor and delivery. So who can benefit from this treatment? Really, any one that's pregnant, but specifically mothers presenting with a breech presentation. There's been a high success rate reported with the baby being able to turn into the normal RAO or LAO presentation. But this technique has also been used, or it is frequently used here with me at the clinic with patients, women that present with a baby that's posterior. And Stephanie did a good job of explaining what that is. It's very, very common for posterior babies, as she said, given time, for those babies to move and rotate into the anterior position. They can be born posterior, but it's not good for the baby or for the mother. It's much more traumatic. One of the things that happens is that when she showed that a posterior baby, let's say the back of my fist is the occiput, the back of the head, and this is the face, my fingertips. As they come down posterior, one of the things that happens is literally the baby's occiput pushes against the cervix, or excuse me, pushes against the sacrum. And these holes here are where the nerves exit from the sacrum. So you've got the back of the baby's head not pushing on the cervix, which helps the cervix to efface and dilate, but that pressure of the contractions is going on the front of the sacrum. And that's one of the reasons why it causes many times significant back pain, or what women will call back labor, because you're literally traumatizing the nerves. But that's the only way the baby can come out, unless they pull it out the other direction doing a C-section. So, but as the baby rotates, then as Stephanie was showing, it puts the advantageous pressure on the cervix, but it reduces the pressure on the tailbone and on the sacrum. It's a double whammy too, because not only does it cause pain, but many of those nerves that come from the sacrum are the very nerves that control the contraction and dilation of the contraction of the uterus and the dilation and effacement of the cervix. So you've got pressure on nerves that is going to affect their ability for your uterus and your cervix to function correctly, and it's also causing pain. So it's a double problem. So posterior, although breech is especially dangerous, mostly because, as Stephanie said, most obstetricians in this country won't even attempt to do a breech delivery. But even a posterior presentation is definitely less than optimal. The Webster technique has also been successful with transversalized and even with twins. Now, I would assume that it's not nearly as successful with twins because there's a lot more variance, but definitely can be successful with that. It's important for people to know, though, that this is not an obstetrics breech turning technique. There's an obstetrics technique where they literally, from the outside, try to manipulate and move the baby. It can sometimes be successful, but it is definitely more dangerous or riskier than what a chiropractor does. So I'm not physically moving the baby. I'm removing interference to as I'm going to talk about in a second, the nerve supply, the ligamentous tension, and also the bony alignment of the pelvis to enable the baby to move into the correct position. And then there's detailed stretches and exercises that I have women do to facilitate that also. Okay? So if somebody ever says, "Oh, I can't believe that you let that chiropractor, try to turn your baby," it's important for people to understand I'm not physically manipulating the baby. Now, Stephanie showed a similar picture where you're looking at the pelvis from this angle, okay? And what I wanted to demonstrate is that I agree with her that there's nothing you can do about how your pelvis grows, but I would add to what she said that I kind of disagree a little bit. I don't think that's really the way she meant it. But there's a lot you can do to change the shape of your pelvis as far as the alignment of your pelvis. And you have a copy of this on the handout on your chair, that this shows a common subluxation or misalignment of the pelvis, where, and PIAS stands for that one side of the ilium has moved AS, which is anterior, and the other side has moved posterior. And if you look at the sacroiliac joints here, they're kind of at a 45-degree angle. So it doesn't really move straight forward and straight back, but it moves at an angle. Normally when you walk, these move. And then there's some motion there, but this is a misalignment or a subluxation. We commonly find this in women. And what I'm demonstrating is you can see the difference in the opening of the pelvis when there's that subluxation. It changes or distorts the physical opening. And there's three ways that what I do as a chiropractor in the Webster Technique can benefit a pregnant woman to help with a better fetal position and better labor and delivery. The physical position of the bones is one way, okay? Now this is not good, but a more serious subluxation is actually an IN-EX subluxation. What that means is that the pelvis is rotated is misaligned in a rotation. So one side of the pelvis is rotated out or in, and the other side of the pelvis is rotated out. Now many times these occur in combination. It's most common to have a PIEX and an ASIN together, although it can happen the other way around. But this again greatly distorts the pelvic inlet and also the pelvic outlet. Okay, so go ahead.
Could that person walk?
Yes.
And feel kind of normal?
Yes. Yeah.
Oh my goodness.
Yeah. Yeah. Now this is a demonstration. If you see these, this is actually these slides actually came from a model like this that was positioned to take the picture, because I'm not aware of a technique for taking an X-ray down from the head basically and get this position. So this might be a little bit exaggerated, but I see when we measure for example an IN-EX, we measure the amount of millimeters that the pubic symphysis is off from midline of the sacrum, because it should be midline. I have personally had women where when I take their, it's not pregnant women, but other women that come in usually after they've had a baby, where it might be off by as much as 20 millimeters. And you're right in asking that, because many times just 1 or 2 or 3 millimeters is enough to cause a problem and cause nerve irritation and cause pain, but sometimes it can be dramatic misalignments. Okay? One of the things that makes this possible, or more possible during pregnancy, is that the hormonal laxity that happens, or the hormonal changes, cause the ligaments to become lax. Both the pubic symphysis and also the sacroiliac joints. Much of your spinal joints, there's muscles around them, and there are muscles around this, but this sacroiliac joint is largely a ligamentous joint. And so when there's ligamentous laxity, it's easier for those bones to misalign. The godsend is that it's also easier for the pelvis to literally expand or open up to allow a better labor and delivery. Even to allow somebody who, I can't remember what the abbreviation is for too big of a head, for
CPD.
CPD. Yeah. Even a woman who is maybe technically CPD, even if the head circumference is actually larger than the pelvic outlet, it is very common for the pelvis to literally move apart to allow a labor and delivery. So, okay. But because of that, and also because of the extra weight of the baby, it's much more common for women to have more significant kind of subluxations. That's one of the reasons, even if we weren't even looking at fetal positioning and better labor and delivery, one of the reasons why it's so important to be adjusted or checked when you're pregnant. So I said that there's 3 things that can cause problems. The next thing is the neurology. The nerves that come off from the sacrum and from the lumbar spine are what control, and I realize this is might be a hard to read diagram, but this is the sympathetic chain that comes from the thoracic spine and from the upper lumbar spine down to about L2, and this is the sacral nerves, or the parasympathetic nerve supply that comes from the sacral area. You can see they come together and they form an intermixed network that then innervates the cervix and then the uterus. And so if you've got subluxations or misalignments, it can pinch or irritate the nerves that exit the spine and also the sacrum. It can cause a pinching effect of those nerves. I should have grabbed it. You know where the example is, don't you? There's 4 models that are just like 2 segments of the spine with the nerves. Can you grab one for me? But anyway, so the second way that's huge is if there's subluxations or misalignments in the spine, it can affect that nerve supply, so it can cause a tightening or uterine constraint of the uterus, making it hard, creating less room for the baby to move into the right position. So one of the things that happens when we adjust somebody is it helps to normalize the muscular integrity, the muscular nerve supply going to the uterus, and it allows a lot of times a relaxation, which then makes more room for the baby to move into the right position. Thank you. Probably more importantly than that is that it allows for, like I said, during labor and delivery, these muscles are working. The cervix is thinning and actually pulling up and around, and the uterus is contracting and pushing down. And if there's not proper nerve supply going to that, this balancing act, then it's not going to function well. And then it can create that failure to progress kind of a problem that can result in a C-section or a less than optimal birth. I just want to, thank you, Stephanie, for doing this. I just wanted to demonstrate, I realize this doesn't have the nerves on it. So this is a segment of the lumbar spine. So if the spine is out of alignment, if it's shifted out of place, it can directly pinch or irritate the nerves and then affect, like I said, what those nerves go to. In the pelvis, it can affect the nerves that come through this area and around through the sacroiliac joint. Okay? So that's a second way. The third way gets back at the picture where she talked about the ligamentous attachments of the uterus. That if she mentioned that the broad ligament and the round ligaments attach into the pelvis and into the sacrum. Imagine what it does to those ligaments when the pelvic bones are torqued like this. It causes tension or constraint on those ligaments. And that's the third way that it can cause uterine constraint. And as we correct this, it relaxes those uterine ligaments. And they're also with the Webster Technique, not with everybody, with some of the patients, there's specific spots where I might contact the round ligament to try to help to relax that ligament, almost like a massage therapist would do to relax a trigger point in the muscle. Okay? But the biggest thing we do is adjust the spine to normalize that tension on the ligaments. Okay? All right, I want to talk next, because for me this is a natural transition, about chiropractic care then carrying over to the newborn. Even a normal labor and delivery or an optimal labor and delivery can be somewhat traumatic to a baby's spine. The neck especially. But especially if there's some type of a problem, which I'm going to get into next, whether it's a posterior presentation where the baby has to work much harder to turn around, if it's a breech presentation, if there's a more invasive things that have to be done, like a vacuum extraction or forceps. Okay. It's critical to check a baby because next to pregnancy, a newborn is probably the most important time to be adjusted, because your nervous system is still developing when you're a newborn. We're not born with fully developed nervous systems, and actually up to about the age of 2, there's a window of opportunity for that neurological development. And what a window of opportunity means is that, like a physical therapist that might work with an injured child would tell you, that if you don't make certain changes by the age of 2, sometimes those it's difficult or impossible to make those changes later on. Okay, so it's an extremely important time. The other thing that's important is that the most commonly injured area in a newborn is the upper cervical part of the spine, which is where the brainstem turns into the spinal cord. It's the most important part of your nervous system. It's literally what controls all of our life-sustaining basic things like breathing, respiration, heart rate, blood pressure, those kinds of things. So it's an important area to make sure, especially when we look at scary things that can happen to newborns, like sudden infant death syndrome and things like that. You look at if there's nerve irritation at the brainstem that controls breathing, that can be a really critical area to make sure we remove that nerve interference. Okay? Oh, I should mention too that for those of you that haven't seen a chiropractor before, that adjusting a newborn is very different from adjusting an adult. It's fingertip kind of pressure. It's extremely gentle. Most of my newborn patients, if they're asleep when I'm adjusting them, they stay asleep. A lot of times, if they are awake, they will fall asleep while I'm adjusting them. So it's different. And I also should mention for those of you that are pregnant that haven't been adjusted during pregnancy, that a good chiropractor that's familiar with adjusting and treats pregnant women regularly will know that you also use a lot less force when you're adjusting a pregnant woman, because that ligamentous laxity, you don't have to push as hard. So it's the techniques are modified for a pregnant woman. Okay. And then all children really should be checked by a chiropractor, but especially if something happens, and sometimes things happen just, you can do all of the right things, and sometimes, you know, things happen where you have to have a vacuum extraction, or you have to have forceps delivery, although they don't use those as much anymore, or C-sections. Those all greatly increase the risk of injury to the baby, to subluxations of the neck. So it's especially important for these children to be checked. The other thing also is that most women, or not most women, some women have the idea that the faster labor and delivery, the better. And that's not true, that a very fast labor and delivery doesn't allow the baby time to transition to the birth canal. It also doesn't allow the mother's tissues to adapt to that pressure of the head coming through the birth canal. So you're much more likely to have tearing and problems, even with problems of subluxations from the birth process.
Is there an ideal time? I mean, that would be like perfect timing, like not too fast? Or what would be like too fast? Or what would be like, okay, that was not that fast, but it wasn't too fast?
You know, I don't know I don't know that anybody, because it can vary. So a woman that's had 11 children, her body already knows what it's doing. Her body's already had to adapt a number of times to that, so they are likely going to have a much faster labor and delivery. A first-time mom is very unlikely they're going to have that fast of a labor and delivery. I get concerned, for example, when I take a history and the woman says, "Oh, I only, I was only in active labor for an hour, or for 2 hours or something." That's most of the time at least a red flag to me. That I need to really check that baby carefully and ask a lot more questions. So
yeah, the babies whose moms have 3-hour labors, they come out kind of stunned and shocked a lot, and you have to kind of work with them to get them to figure out what's that, breathe.
They're now in a new environment.
This is maybe more depth than I planned on getting into during this presentation, but there are, and Stephanie would probably echo this, that there are some great advantages to a baby of coming through the birth canal. There's a lot of theories and evidence that the compression that happens around the baby's head is actually very beneficial to some degree, as well as the exposure to beneficial bacteria and so forth as they come through the birth canal. So, so transitioning in a normal rate is actually beneficial. I'm going to show a short little video here that is an interview with a chiropractor that just kind of
I'm Joyce Brewer with MommyTalkShow.com. We're joined by Dr. April Warhala and the Cafe of Life Chiropractic Care here in Grant Park. Now, Dr. April, I came to you when I was pregnant with AJ. I was having some issues. I was wobbling around. I was feeling my joints and things were out of place. What do moms get out of coming to a chiropractor like you? What sort of relief can they get when they're pregnant?
Yes, Joyce, much relief is the answer. Typically, when a mom is pregnant, there's a hormone release called relaxin that relaxes the ligaments and tendons for a reason. You're opening up the pelvic girdle as the belly enlarges for the baby to come out in the birth process. But with that, sometimes distortions happen that are uncomfortable to a mother. Maybe one side is released more than the other, and sometimes even those bones will put pressure on the surrounding nerves. So there's all kind of pains and aches that a mom will come in for during pregnancy. What we do here is safe, effective, gentle chiropractic care that helps to realign the misalignments that have occurred with that adaptation process when the mom is pregnant. And so we adjust them and relieve that nerve pressure, as well as just giving them the support they need through pregnancy. It actually not only helps them to feel better, many mothers actually say that it helps to ease the birth process itself. It becomes quicker and more effective.
And then once the baby is born, sometimes you even treat newborns and give them adjustments too.
Absolutely, and I have to say that is my passion. I was adjusted when I was born, and I believe it's crucial for all babies to be checked at least by their chiropractor. The birth process, as gentle as we think it might be, is actually traumatic, especially in today's society. So when the baby is born, typically today it's born through cesarean section, which the baby doesn't get the opportunity to go through the canal like it's supposed to, and is often pulled from the belly. Even if they do come out through the canal, oftentimes the doctor will still put their hands on, twist the neck, and pull the baby's head out. So that puts a lot of strain on this very precious, gentle nervous system in the child. So we just love to check them and make sure that everything's functioning as it's supposed to give them the best start possible.
That is wonderful, because I think a lot of people may not know about that, and I'm not sure that pediatricians always know, but it's good information in case, you know, moms may notice something with their baby or just want to get them checked, like you said, when they come home from the hospital.
Absolutely, and some really effective things we've seen change in newborns that get adjusted regularly. Ear infections clear up, constipation clears up, colic. There's all kind of different symptomatic things that are freed with the baby undergoing chiropractic care. So it's a very, very good way to give them a good start.
Well, thank you so much for that information. That's going to be so vital to the parents who actually watch Mommy Talk Show. Thank you so much for joining us from MommyTalkShow.com. I'm Joyce Brewer.
Yes.
I wasn't sure if I caught on there for obvious reasons, but did they mention like immune support too? Like that when your body's aligned, that your body, you know, has a stronger immune system, especially, you know, for babies and...
Yeah, she did not mention that, but
Okay.
that's integral with what I do. That's why that one of the first slides I showed where I was talking about chiropractic, I was trying to get across the idea that it's not just about optimal fetal positioning, that it's really about improving the way your nervous system functions, which controls everything. And that's such a all-encompassing statement that it's hard for people to wrap their mind around. But yeah, your immune system definitely. And these things are not just my opinion, or even I've been in practice for 20 years. I mean, I have a lot of clinical experience of seeing like children that come in that are constantly sick, and then I adjust them, and their immune system is vastly better. But there's also a lot of scientific research that shows that chiropractic, when we improve how the nervous system functions, that it literally improves everything from immune function to digestive function to hormonal function to even genetic expression. There's a whole field of study now called epigenetics. Has anybody heard of that? And it literally means upon the genes. And what they found is back in the 50s, Watson and Crick are the ones that discovered that we have genes to begin with. And then in the 1990s, they started a worldwide collaborative scientific research study called the Human Genome Project, and they were mapping out all the genes in the human body, and they were successful at doing that. In 2003, they were able to do that. What they found was that our genetic makeup is not really that complicated. We have about 20 to 25,000 genes. Roundworms have about 20,000 genes. So, but what they discovered after that is that it's how those genes are expressed that's really important, how they're turned on and turned off. When we talk about nerve supply, when we also talk about how you eat, how you think, and how you move, that literally affects gene expression. For example, you can have identical twins that have exactly the same genes. They're born genetically identically, but they can have very different health expressions. There's a study called the Danish Twin Study where they found that only about 20% of your health is determined by your genes. 80% of it is determined by how those genes are turned on or turned off. And so nerve supply affects that, how you eat, how you move, your mental state affects that. The really interesting thing is that those epigenetic changes can be inherited or passed down. So let's say, for example, you have a woman who is pregnant, but during her pregnancy she's under extreme stress. That could cause, like you mentioned, more cortisol to be released, more stress hormones, which not only will change the way that baby develops, but it will have that baby be born with a heightened cortisol level on an epigenetic level. So the cool thing is it can work the other way. Dr. I'm blanking out on his name right now. There's a well-known doctor that did some research where he took 500 men that had prostate cancer, and he found by making lifestyle changes that it actually changed their genetic makeup. Not only did the prostate cancer get better, but when they did genetic testing, Dr. Dean Ornish was the man's name, and they found that on a genetic level that their body had literally changed. So the reason I bring that up is that one of the things that's different about chiropractic too is that, like I said, we have a belief or a philosophy that the body is intelligent. It's designed to heal, and science is showing that this is true. And so you should feel empowered as a patient that you have a lot more control over your health. 80% of your health has to do with things you have control over. Only 20% of it has to do with just the luck of the draw of who your parents were. Okay, so good question. I'm gonna. Oh, there we go. There should be a picture of that one. I may have to demonstrate it. Okay, so the adjustment is important, but in addition to the adjustments I do as part of the Webster Technique, there are specific exercises I have women do, and at different stages of what their problem might be. So let's say the woman presents and she's breech, or she presents with other than a RAO or LAO presentation, so her baby is not in the optimal position. I am going to have her do, depending on how many weeks she's at, either, to begin with, I might have her doing pelvic rock exercises. Every hour I might have her do 30 or 50 of these. If she's at 38 weeks or 39 weeks and the baby's breech, I might have her almost continually doing this all day long. Okay, so the only way I can do this is probably to get down and show you, okay? So a pelvic rock is or some people call it a pelvic tilt, is you're on your hands and your knees, and it's basically in yoga what they call a cat-cow stretch. So first you tip your head down and you round your back up, and then you do the opposite. You tip your head back and you let your stomach come forward, the cow part of it. And I always tell women to actually imagine that their pelvis, that when they tip their head back, that they're pouring water out of their pelvis. Imagine they're tipping their pelvis forward, and when they do the cat part, that they are holding water into their pelvis. So that's what you want to mentally imagine as you're tipping the pelvis. And really what we're doing is trying to unweight the baby. The baby's in the wrong position, so we're trying with this stretch to tip the pelvis forward, unweight the baby so it can turn. And we're also, the other benefit from a chiropractic standpoint is that pelvic rock helps to gently exercise these sacroiliac joints and gently exercise the lumbosacral spine. Movement in the spine is really important. Movement actually drives the nervous system. It stimulates the nerves. There's a lot more of the nervous system that feeds movement information back into the brain and actually affects higher brain functions like memory and mood and so forth than there is nerve supply that controls things like muscle contraction and so forth. So a huge part of the nervous system is sensory in nature. It feeds back into the brain. So movement is important. Another thing I might have a woman do that's in that situation is have them, again, try to be in an unweighted position. So because your arms get tired of just being on your hands and your knees, just reclining on a stability ball like this can be a great position for a woman who's trying to encourage the baby to turn. Some birth professionals will actually even encourage a woman to be inverted. Like I've heard of different birth professionals encouraging their patient to maybe even like lay on an ironing board at an angle or do things like that. I usually don't recommend that just because I'm always worried that the pregnant woman is going to fall or be injured in some way. But definitely unweighting the baby like this is ideal. I like this picture. It could even be a smaller stability ball if the woman was really close, like 38, 39 weeks, and the baby was still in the wrong position. I might even have her put her arms or her chest on like an ottoman or something that was lower than her hips, try to unweight that baby. Swimming is great exercise for pregnancy, especially if your baby's in not in the optimal position, because especially if you're swimming with the belly down, it can encourage the baby to not only have room to turn, but it also can encourage the baby to be in the anterior position. Stephanie mentioned that part of the reason that the baby naturally should move head down is because the head is heavier. The back of the baby is also heavier. So when your stomach or your pelvis is forward, it encourages the baby to move forward. Okay, so if the baby is not breech, but it's posterior, I would recommend some of these same things, but I would also recommend that the woman avoid reclining positions like the plague, because it encourages that baby to move into a posterior position or the wrong sunny side up position, because the heavier part of the baby tends to rotate back. This is especially important for first time women when they're in the first stage of their labor, where they get a contraction, and but the contractions are regular, they're spaced apart. A lot of women during that phase will sit back in a recliner and kind of relax. They're getting ready for the big event, and so it's a good idea to rest a little bit, but that's the wrong position to rest in. I would actually recommend, and I don't know if you would recommend this too, that actually from about 34 to 36 weeks till the end of your pregnancy, I recommend you avoid that reclining position as much as possible. Even to the extent of when you're sitting in your home, to think about putting some extra pillows under your bottom or an extra pillow behind your back so that you're more in a forward position. The Taylor sit kind of a position that you showed when where the person's sitting basically like what my kids call crisscross applesauce, again allows the pelvis and the belly to be forward, which is an advantage. Okay? So we want to do everything we can to encourage that optimal position. So you might want to sit like this also. Might be good. It'd be better if her knees were lower than her pelvis. Okay? Now this is a completely different kind of exercise. Especially if I have a patient where the baby was previously breech or posterior, and then I get the okay because somebody like Stephanie is more talented than I am at doing feeling the position of the baby. They say, the midwife will come back and say, or maybe if you have an ultrasound, and say the baby has head down. Now what we want to do from my perspective is we want to trap the baby in that position. We want them to be in that position. So squatting opens up the pelvis. It actually opens up the pelvic inlet and the pelvic outlet, and a lot of women will birth in this position because of that. But it's also really good toward the end of your pregnancy to allow the baby to stay in that optimal position. Okay, so there's a couple ways you can do this. You can do this with your husband or with your partner. You can have them hold you and support you, which is a really good idea. And you want to just be in that. I usually have women drop down into that low squat position and have them hold it. There's another added benefit, is that this is strengthening for the same muscles that you might find is a good position for you to birth in. So this can be a great technique to do, although I would not recommend you do this if you have a baby that's not in an optimal position. Okay? You can also hold on to something. This shows her holding on to both sides of a doorknob. A lot of times I have women hold on to, if they have a good-sized bedpost on the end of their bed, they can hold on to it and do this position. If you're strong enough, you can do it without holding on to anything, but this usually requires you having done some of this ahead of time, not waiting until 36 weeks or 34 weeks along. But you can almost imagine by looking at these pictures, you can almost see how the pelvis is kind of spread apart and opened up. And I am open to questions if anybody has any questions.